Hello, my name is Jonas Lehner and I'm an oral surgeon from Germany. Some years ago, one of my patients introduced himself with increasing loosening of his teeth in the maxilla, which were supporting a removable denture. It was clear that he would lose all the rest of his teeth. He was 67 years old at this time. After I had treated the edentulous mandible successfully with a removable denture supported by implants in the past, he now preferred fixed teeth and, if possible, a solution with immediate loading. I told him that we could place implants right away for an immediate loading protocol, or instead that we could wait for a new Straumann product that would be launched during the next months, an implant which would be more suitable for his situation and which I would prefer. So we agreed on waiting for the launching of the BLX. I was going to have the opportunity to take part in the limited market release.
Meine große Sorge war, dass die Implantate im Oberkiefer nicht so versorgt werden können, wie ich mir das gewünscht hätte. Und das gleiche Prozedere wie im Unterkiefer wäre dauernd mit den Prothesen einkleben.
Unfortunately, during the planning of the case, I found a mesiodens on the CBCT, which I had not seen in previous X-rays. The base of the maxilla was quite narrow, so I had to place one implant right through the region of the osteotomy. And so I began wondering, in this case, am I taking too many risks? This was my first BLX Pro Arch case, and the mesiodens was an aspect which was hardly predictable. So I told my patient, if I don't get the primal stability we need, it will not be possible to have immediate loading of your implants. This indeed put me under tremendous pressure. The patient's expectations were extremely high, but he trusted in me 100%. I myself trusted in Straumann to 100%. I was sure that the BLX Pro Arch would be extremely well designed. At this time, the patient and I had been waiting for almost 1 year to have the surgery done. At first, there was the launching of the BLX, and some months later, the components for the Pro Arch were available. After all components had arrived at my clinic, we immediately did the surgery. At first, I left 2 teeth to fix the surgical template. This is the mesiodens. Fortunately, removing it went very well. At this time, the BLX guided system was not available, so I was planning with the BLT and using the BLT drill just for the pilot drilling. This is the drill through the place where the mesiodens just was removed. And here the implant is coming. It went very smoothly through the thin crestal part without causing any cracks, and in the apical part it had a primary stability of 50 Newton centimeter. Here are the SRAs, and here an intraoral scanning with the trios with the scan bodies mounted. This is the final X-ray with the 3 other implants. One was also an immediate implant. This was the immediate provisional, and this is the final situation. The patient was so happy and relieved. And this is the clinical situation and the X-ray after 3 years. For my team and me, this patient is one of the biggest fans. He was so happy and so thankful. For me personally, it will always be a very special case. Indeed, I took some risk, but I was confident and I was 100% sure that I can trust the quality of the components. Overall, it possibly was one of the first BLX Pro Arch cases in the world in 2018.
Ich war dann überglücklich, wie das dann trotzdem so passiert ist und so gelungen ist, wie ich mir und auch der Zahnarzt es sich gewünscht haben. Es hat sich sehr viel verändert, weil das ganze Prozedere, das wir beim Unterkiefer hatten, war beim Oberkiefer einfach weg. Das hat sich einfach die Lebensqualität verändert, weil man normal wieder essen kann und alles wieder essen kann, wie man es sich wünscht. Ich hatte beruflich mit alten Menschen zu tun und konnte sehen, wie problematisch ihr Leben, ihr Alltag war mit Prothesen. Darum war ich sehr, sehr dankbar, dass das also oben so geklappt hat. Das ganze Lebensgefühl ist anders, es gibt mehr Sicherheit und nicht zu vergessen auch der optische Aspekt. Es ist also schön, wenn man lachen kann und hat schöne Zähne im Mund. Ich bin sehr dankbar, dass diese Möglichkeit gegeben war mit der Behandlung von Implantaten. Ich bin Herrn Dr. Lehner sehr dankbar, dass er mein Leben dadurch wesentlich verbessert hat.